With Papua New Guinea having some of the lowest health standards in the region, it's important to communicate key health messages to the community in the most effective way possible. The Papua New Guinea government, with the support of the global community, has put in place a strategy to raise health standards across the country. Communication will be a major part of the strategy. A major initiative planned and approved by the government is the construction of community health posts in each region of Papua New Guinea. These facilities will provide vital health care for everyone. In addition to providing health services, these posts provide the opportunity to implement a major information and education program. There's a unique opportunity to incorporate a dedicated visual learning centre into the design to fully maximise the communication of health information to communities. A visual learning centre is different from a traditional education centre, as all text-based resources are collated and translated into visual media before being presented and distributed to community members. This ensures vital information on health reaches people of all languages and literacy levels and has the highest possible impact when raising awareness on health issues. The visual learning system will be embedded into the Department of Health. Key staff will be trained in the visual development system, and the department will have complete control and ownership of the visual communication process and information. The community will have the benefits of receiving the latest health information from around the world in a visual format. The visual delivery process has proven to decrease the time it takes to understand information and increase comprehension significantly. The Education Centre will sit within the facility grounds and contains a range of information and education delivery methods, including graphic prints, data projection, and iPads. All visual resources will be presented using these media devices. This Visual Learning Centre will be a central point for community members to gather and learn together. For example, there may be information evenings including animation, video, and slideshow presentations on health and wellbeing topics. In addition, the Visual Learning Centre will become a hub for accessing e-learning courses. This can include short courses through to full qualifications for community members. The best e-learning courses from around the world will be assessed and collated through the Visual Learning System and be available for all community members throughout the country. The Visual Learning Centre also provides the opportunity to distribute information throughout a region using a range of communication methods. For community members unable to reach the community health posts, a strategy will be in place to ensure they receive regular health-related information in a visual format through a range of media. This visual communication system has the advantage of distributing critical information in a short time frame. For example, if there was a viral outbreak, such as the Ebola virus, information can be translated to visuals and distributed to visual learning centres for community seminars, and then distributed throughout the region using predetermined channels. Visual information, including animations, graphics, and videos, can start reaching the visual learning centres within 24 hours of a health alert occurring. Our rapid development system means information gets out a lot faster and more effectively and complements other services such as broadcast television. The system uses the same communication channels to deliver ongoing information on topics such as maternal health. This ensures community members can be constantly reminded of key health practices in an engaging and easy to understand way. The visual learning system allows the community health centres to utilise the most appropriate communication channels to deliver relevant, engaging and appropriate resources for all languages and literacy levels in the community. V-Learning will train, support and empower Department of Health staff by providing knowledge and systems to implement visual learning strategies in all communication. The Papua New Guinea government will be able to distribute enhanced and effective information to all people of Papua New Guinea in an expedient way using the visual learning system.